My name is Kim Hardy. I am a family practice physician from Wisconsin, and I have been in Haiti for 10 days. Today is my last day, and I'm going to be going home. I didn't know what to expect when I was coming down here with Heart to Heart. I didn't know what kind of medical facilities we would have and what kind of medical issues we would be seeing. We've seen quite a variety of things. We're not seeing the acute things from the earthquake, but we're still seeing a lot of residual, a lot of post-traumatic stress disorder, a lot of people with chronic headaches, they can't sleep, there's a lot of stress. We're seeing still some follow-up for fractures. I've had a woman who, during the earthquake, was cooking with a large pot of oil, and she fell in and couldn't get out, so she's still suffering from burns and is coming in for dressing changes. I saw a woman who had a crush injury to her wrist, and she went to the hospital, and because they're only treating very urgent and dire things, they basically just put a bandage on her wrist, and she made her own splint and had her wrist in a splint for the last 2 months, and now has contractures of her fingers, and it's basically stuck like this. So we've been working with her to give her exercises to get her range of motion back. We've seen a lot of abdominal pain and chronic headaches, a lot of vomiting and diarrhea in the babies. The range of illness has been great. Some are very mildly ill with your general colds and a little bit of virus, all the way to we've had several sick babies that we've had to transfer emergently to the hospital for dehydration. They were very, very ill and near death. The hospital right now, because they're so overwhelmed, is only taking gravely ill patients. So one of our struggles was finding what to do with patients who need care, such as an inguinal hernia needed to be repaired, but no one is doing that surgery because they don't consider it urgent. So there's the hospital takes care of those gravely ill. We do what we can do in the clinic, but then there's this group of individuals that still need care, but there's nowhere to send them, so that's frustrating. One thing that I really enjoyed being a primary care physician was to be able to see my patients multiple times. I would have them come back to me specifically if I had seen them once and they needed to have dressing changes for their wounds, or if I had sutured a child, they would come back to me for wound checks. So I really enjoyed seeing patients multiple times, and I didn't think I would have that down here. The people that work at the clinic, the translators and the volunteers that are security have been absolutely wonderful. I've never felt unsafe or that my life was in danger. I felt they make us feel comfortable. They watch our back. They are just a joy to work with and really make the clinics enjoyable in a very difficult situation where you're seeing people living on the street, people living under tents. Very often, people haven't gone back to their homes or don't have homes, or their homes were destroyed. So it's very difficult emotionally, and the support that we get from the other medical volunteers as well as the translators and security at the clinic has just been phenomenal, and really has helped to complete this adventure and experience for me. I didn't know what to expect, as I haven't done something like this for a long time, and it was very rewarding, and I would do it again and would recommend it to anyone who's looking to help out this country who's in dire need.